This presentation will focus on the following: history of Philhealth, membership categories, benefits, payment schemes that include fee-for-service and case rates. The Philippine Health Insurance Corporation, or Philhealth, is a tax-exempt, government-owned and controlled corporation that deals with healthcare financing and is attached to the Department of Health. It aims to provide quality health care for all Filipinos by ensuring a sustainable national health insurance program for all. In line with the vision mission of PhilHealth, all strategic plans and objectives of the corporation shall be anchored in the new PhilHealth vision and mission statement. The governing board of PhilHealth is composed of a comprehensive representation of different stakeholders. The Secretary of Health serves as the chair of the board, and the president or CEO of PhilHealth as the vice chair. Various departments of the government, which includes the Department of Labor and Employment, Department of Interior and Local Government, and the Department of Social Welfare and Development, government and private insurance corporations such as the GSIS and SSS, and other stakeholders are represented as well. A short history of PhilHealth will be discussed. The call to serve the rural indigents, echoed since the early 60s, led to the Philippine Medical Association introducing the Maria Project. This provided physicians to rural areas without doctors. After years of public pressure for a national health insurance plan, the government under President Marcos enacted the Philippine Medical Care Act of 1969, and this was implemented on August 1971. It was planned to provide a comprehensive medical care program that would be introduced gradually. Program 1 was put into effect on January 1972. It covered private and public wage earners who were insured under the Social Security system and the Government Service Insurance System, respectively. Program 2 was to eventually cover everyone else. This was expected to become fully operational by the year 1974. The Medical Care Act compensated the healthcare institutions and providers of surgical and medical services according to a fixed schedule. The Philippine Medical Care Commission was tasked to oversee the implementation of this program. In the 1990s, the passage of several bills made the national health insurance more comprehensive in terms of covered population, benefits, and health financing. This included House Bill 14225 and Senate Bill 01738, or National Health Insurance Act of 1995. This was signed by President Fidel V. Ramos on February 14, 1995. This law paved the way for the creation of the Philippine Health Insurance Corporation, mandated to provide social health insurance coverage to all Filipinos in 15 years' time. The National Health Insurance Program, administered by PhilHealth, was established in 1995 with the passage of Republic Act 7875. It provides health insurance coverage and ensures affordable, acceptable, available, and accessible health care services for all Filipinos. Payment scheme for health providers is the fee-for-service, wherein physicians charge separately for each patient encounter or service rendered. PhilHealth took over the Medicare functions previously administered by the Philippine Medical Care Commission since 1972. Its mandate is to provide health insurance coverage to all Filipinos. In 1977, it assumed Medicare functions for government workers from the Government Service Insurance System, or GSIS, and a year later for the private sector's workers, which was previously administered by the Social Security System. In the same year, PhilHealth started the Indigent Program. In partnership with local government units, PhilHealth enrolled millions of families who otherwise have no access to health services. To date, all families in the DSWD National Household Targeting System for Poverty Reduction are covered by PhilHealth. In 1999, PhilHealth started covering self-employed and the informal sector. In 2005, it assumed Medicare functions from the Overseas Workers Welfare Administration or OWA for overseas Filipino workers. In June 19, 2013, Republic Act 10606 was passed, which provides mandatory health care for all Filipinos. It ensures coverage of the marginalized by prioritizing healthcare needs of the underprivileged, sick, elderly, persons with disabilities, women and children, and provide free health care services to indigents. There are several membership categories: formal, informal, indigent, sponsored, and senior citizens, and the most recently added, lifetime members. Members in the formal category include those with formal contracts and fixed terms of employment, including workers in the government and private sector. The premium contribution and payments are equally shared by the employee and the employer, not exceeding 5% of their respective basic monthly salaries. Members in the informal economy include those who are self-earning and migrant workers. Lifetime members are those who have reached the age of retirement and have paid 120 monthly premium contributions. Indigent category includes persons who have no visible means of income or whose income is insufficient for family subsistence as identified by the Department of Social Welfare and Development based on specific criteria. Sponsored members include those whose contributions are being paid for by another individual, government agency, or private entity. Senior citizens are those who are 60 years old and above and are not currently covered by any of the existing membership categories of Philhealth. Philhealth coverage also extends to the immediate family of its members, which include legitimate spouse who is not a member, child or children 21 years old below, child or children over 21 suffering congenital diseases, foster child as defined by the Foster Care Act of 2012, and parents 60 years and above or parents who have permanent disabilities regardless of age. The following are the benefits that can be availed from Philhealth: inpatient, outpatient, Z, and Millennium Development Goals benefits. The Philhealth member must be admitted more than 24 hours in a Philhealth accredited facility to avail of the inpatient benefits. This is inclusive of room and board, professional fees, drugs and medicines, operating room, supplies, laboratory, and ancillary procedures. Maximum benefits will depend on the case type of illness, services rendered, professional and hospital category, and patient's length of stay. Outpatient benefits include ambulatory or outpatient day surgeries, radiotherapy, hemodialysis, outpatient blood transfusion, and primary care benefits. Primary care benefits include preventive services, basic diagnostic examinations such as complete blood count, urinalysis, fecalysis, among others, and drugs and medicines for asthma, acute gastroenteritis, upper respiratory tract infection, and urinary tract infection. The newest package of Philhealth that will primarily address catastrophic cases is called the Z benefit. This includes illnesses that push patients into prolonged hospitalization and very expensive treatments. These illnesses are listed in the table. A no-balance billing or walang dagdag bayad or no payment is applicable for sponsored members, while fixed copay or fixed amount will be paid on top of the package by non-sponsored members. Included in the package are payment for hospital services such as hospital room and board fees, drugs and laboratory exams, operating room, and professional fees for the entire course of treatment, including mandatory and other services required per illness. MDG or Millennium Developmental Goals related benefits are the diseases or conditions that are covered by the WHO Millennium Goals, which include improvement of maternal health, reduction of child mortality, and combating major communicable diseases such as HIV, malaria, and tuberculosis. Now,